This is Denise Hayes. We're doing the axial skeleton. So start with the frontal bone here, parietal on the sides here and here, occipital here in the back, and this is the external occipital tuberance, which is the trapezius muscle attaches to it. Also the nodular ligament. Here on the sides we have the temporal bone. Here we have the temporal mandibular joint here. The mastoid process is here. The styloid process is here. The external acoustic meatus is here. The squamous part is here. The petrous part of the temporal bone is here. The internal acoustic medius is also in here. The synoid is back here behind the eyes. You've got the greater wing here. The greater wing with the superior orbital fissure, which optic nerve 3, 4, and 6 pass through. Inside, we've got the greater wing and the lesser wing, the optical canal, which the optic nerve and the optical artery pass through, and then the sella tertiaria, which the pituitary gland sits on. Inside the eye here we have the ethmoid, which the crista galli supports the olfactory nerves in the olfactory bulb. The cribriform plate in here, which the olfactory nerve passes through. And the sutures, here we have the coronal suture, which connects the frontal and parietal lobes bones. The sagittal here, which connects the two parietal bones. The lambdoid here in the back, which connects the parietal and the occipital. The squamous here, which connects the parietal and the temporal bones. The facial bones here, the maxilla and the alveolar process, which is where the tooth sockets sit. The nasal up here, which is the bridge of the nose. The zygomatic, which you hear the cheekbones. This is the zygomatic arch over here, which contains the zygomatic process of the temporal lobe here, and the temporal process of the zygomatic bones, which make the temporal arch. The ethmoid is here in the eyes behind the lacrimal. The vomer, which is there in the nose, which consists of the vomer and the ethmoid. The inferior nasal concha, which is in here in the eye orbits, which warms and humidifies air as it passes to the lungs. The mandible is here. And we have the body of the mandible, the angle of the mandible, and the ramus of the mandible. The mandibular condyle is here in the back. The mandibular notch, so this little arch here, and the coronoid process is here in the front of the mandible. Now for the vertebrate column, there's 4 curvatures. The primary curvatures are the thoracic here and the sacrococcygeal here. Those are the primary. The secondary are the cervical curve and the lumbar curve here. The cervical vertebrae, this is the atlas here at the top, which the atlas articulates with the skull and gives the ability to rotate the head in the S and the yes movement, like this. What's unique about the cervical vertebrae compared to the thoracic and the lumbar is that it contains the transverse foramen, unlike the thoracic and the lumbar. The thoracic vertebrae here, there are 12 of them. This is the spinous process in the back. The transverse process is here on the side. The intervertebrate foramen passes the spinal nerve, the spinal artery, the veins, and the ligaments pass through there. The body, this is the body of the vertebrae. The larger part in here is the body of the vertebrae. And then the lumbar vertebrae, those are down here. There's 7 of those starting here down. And then the sacrum and the coccus is down here. There's 5 vertebrae of the sacrum. And then the sternum, this is the manubrium here. This is the body and the exvoid process down here. The jugular notch is in here, this little space here that creates the concave space between the clavicle and the sternum. The true ribs, these are the true ribs that attach to the sternum. These are the false ribs down here that attach to the 7th vertebrae. These are the false ribs. These are the floating ribs in the back that don't attach. They do not articulate to any other one. Now for the ribs, this is the head of the rib that attaches to the vertebrae, the neck of the rib here, and the tubercle that is down in here. And the ribs articulate to the vertebrae here with the interarticular ligaments that attach above and below on the ribs.